Hi, my name's Dr. Jo Crane. I'm one of the consultants in community paediatrics in Portsmouth. This little video is going to be about sensory processing and how that links in with our hand model. If you think that your child might be on the autistic spectrum, or you've been diagnosed with your child's on the autistic spectrum, it is likely, not 100%, but very likely that your child has got sensory processing difficulties. Now, our senses are, and this is where I have to remember all of them, we've got 5. Our normal ones are our vision, our hearing, our taste, our touch, our smell, hearing, I've done that one, haven't I? And then we've also got ones like what's called auditory vestibular, so like how we like to spin, where we feel the world around us, that's our proprioception. And all of these things are our senses. Now, if you are a child who has got sensory processing differences or difficulties, they perceive something different to somebody else. So a noise is a really common one. Let's talk about hand dryers in public toilets, the bane of the toddler's life. So if we think about it like this again with our brain, so when that toddler who is going into a toilet hears that hand dryer, they think that something is killing them. So their body fills with cortisol, they flip their lid and they're screaming. And they're screaming, screaming, screaming. And they might fly, or they might fight, they might punch you, or they might try to get out the loo. And so that is because they perceive that sense as something which is treacherous to them, that is really a real threat. You know as a parent it's not a threat, it's just a hand dryer, but actually to them it is a real threat. Now, the way to help them overcome that is, well, when they're little, it's about that rule of 5 positives again. I know you're scared, I know it's really scary, you can do this, we can do this together. I do lots of counting. Let's count to 10, fantastic, well done, you're so good. And that's where that rule of 5 positives comes in all the time. I always compare it, and I'm seeing parents in clinic actually, I always check if they like snakes first, because some people do, but most people really hate snakes. So I talk about it as, if I'm going to put you into a pit of snakes, I've got 2 options. I can put you in that pit of snakes and go, just get on with it, come on, how hard can it be? That's ridiculous, why are you so scared? You know, there's only snakes, you know. Or alternatively, I could say, I know that you're feeling really scared, I'm going to be here with you. I'm going to not desert you at all. We're just going to do it for a couple of minutes. Let's count for 30 minutes. I know you feel awful. You're so good. That is amazing how you manage that. And when you do that, once again, you're getting that oxytocin going. You're decreasing that cortisol. Now remember, you are building pathways in a kid's brain. So this does not improve things overnight. But what it will do is it will actually help you keep your lid down while trying to manage this. And if you keep your lid down, it will help them learn to actually regulate those emotions. And that is so key to this. So I've just used the example of noise, but it is the same for all senses. So if it's something you don't like eating broccoli, you know, she's trying to kill me by giving me broccoli, I'm flipping my lid. Once again, it's about not going, oh, for goodness sake, stop shouting, it's only broccoli. You know, it's actually about, I know that actually you don't like this, but we'll have a go, let's have a lick, fantastic, you're so good. And all of that positivity works on that oxytocin to get that lid back down. I'm on my 4 minutes, so therefore I know I have to stop now. Thank you very much for listening, and I hope that was useful.